reducing fatality of Naegleria fowleri. My name is Amy Escobedo Murillo, and my partners are Damian Sanchez and Kirsten Sanchez.
Naegleria fowleri has been described as an emerging parasite by some and an emerging medical threat by others. Naegleria fowleri has been detected in drinking water distribution systems in Australia, Pakistan, and the US, and it is the causative agent of the highly fatal disease PAM. In terms of the physiological requirements of this brain-eating amoeba, current ecosurveillance risk factors for this protist include elevated temperature and decreased chlorine residuals and microorganisms in biofilms have been proposed as additional factors for supporting the thriving of this protist species. And biofilms support the majority of microorganisms within these water sources, which create niches for these microbes to thrive upon, which enhances their survival of pathogenesis. Malaria is associated with elevated temperatures. It is found in regions where water soils are warm, such as geothermal sources, and grows at temperatures of about 30 to 46 degrees Celsius. Food sources commonly used for laboratory culture of this protist include Klebsiella pneumonia and Pterobacter and E. coli. These bacteria are not all, they're all rod-shaped gram-negative, nitrate-reducing facultative anaerobes belonging to the Enterobacteriaceae family and are part of the normal gut flora. Since normal gut flora would not typically be found in these distribution water centers are indicators of fecal contamination. Bacteria are likely an important food source for this brain-eating amoeba. Because of the human anatomical damage inflicted by this protist, its mode of entry into the human anatomy involves trophozoites infecting a human host through water entering the nasal cavity. This then allows for the amoeba to attach itself to the nasal mucosa, migrating along the olfactory nerves through the cribriform plate until it reaches the olfactory bulb. Trophozoites then enter the brain through the olfactory nerve bundles where they multiply and cause severe cerebral damage and inflammation. The image on the top shows immense swelling of brain tissue, and the second image below displays deteriorated brain tissue on coronal plane dissection. Through a histological examination, on the left, there is a cytopsin of fixed cerebrospinal fluid cells showing a right-stained trophozoite of Naegleria fowleri, polynuclear leukocytes, and some lymphocytes in the around the structure of this amoeba. The nucleus and nucleolus can be seen within the trophozoite at the magnification of about 1000x. The amoeboid trophozoites measure between 10 to 35 microliters, but when rounded, they're usually around 10 to 15 in diameter. The cytoplasm is granular, contains many vacuoles. The single nucleus is large and has a large, dense karyosome. On the right, a section through the cerebral portion of the brain of a PAM patient cells are stained with hematoxylin and eosin, showing large accumulations of trophozoites and Naegleria fowleri and overall destruction of the normal architecture of the brain tissue.
Right now in the United States, and so far, there has been only a total of 7 case survivors who have gotten Naegleria fowleri. Callie Harridge right now, she is a 23-year-old young lady who was first diagnosed with Naegleria fowleri in 2013 when she was 12 years old. She went to a water park 8 days before when she was sent to the emergency department. She already had been experiencing a headache for about 2 days and fever, nausea, vomiting, and some for a day. In the hospital, they did a normal check of her, a physical check, and the white blood cell count, and they found Gemini rice string, which is a consistent of Naegleria fowleri. After 24 hours, they noticed that she seemed to be getting worse, and she also developed intracranial pressure. So they performed many drainages of CSF fluid on her. After 2 weeks, they performed an MRI, and her brain showed that it had blood in her frontal lobes and multiple restricted diffusions. After a few weeks, they did another MRI, and with all the medications, it showed that her brain was improving. She had to do a 26-day out of 28-day antimicrobial course, which consisted of melitosapine, loricostal, rapin, and azithromycin. And these medications have been known to be very useful in survivors. And concerns that we have currently are global warming and water systems. Some major concerns are right now global warming. Global warming has been increasing for the past few years and by a lot. And water system is a huge system that we have that every human needs, and we need to find more ways to improve it since we do kind of have a poor water system. Warming first. It becoming warmer, it causes ocean patterns and temperature changes. As we know, the brain-eating amoeba is a thermophilic, so it loves hot water. Global warming increases, the water temperature is going to increase, and more brain-eating amoeba is going to be more common. Studies show that since 1901, the ocean has been warming up by a total of 1.5 Fahrenheit, and it continues to increase. Water systems. The water system is a major industry necessary for humans. However, they aren't as clean as every year there are cases of different contamination and exposed to diseases being found. For example, some are diarrhea, garitis, dysentery, typhoid fever, E. coli infection, and salmonellosis. One treatment is rapin. Rapin is a medication that is normally used to treat tuberculosis. Rapin is used to kill bacteria and causes infections. Rapin is still being studied by many scientists because they're not exactly sure how it reacts with, so it's still being studied. But so far, in all the survival cases of patients who have contacted this, they have been proven to be very helpful. Concentration of 10 milliliters in 3 days can delay the growth of brain-eating amoeba. Scientists are also noticing that pin is a very drug-to prescription. So they noticed that when they prescribe rapin and also amlodipine B, it has shown to be very beneficial for the patients.
We have also corifungin, which is a water-soluble antifungal drug. Being water-soluble, it's able to be fast-acting because it can be readily dissolved or soluble in aqueous solutions. And this into comparison with amphotericin B, which is hydrophobic, which is basically insoluble or partially soluble in aqueous solutions. It can cause that drug to be less fast-acting. To test corifungin's efficacy, it was first studied in vitro, where a pathogenic strain of N. fowleri was cultured and tissue culture treated 96 well and 384 well microplates and incubated with 3.12, 6.25, 12.5, 18.75, or 25 micrometers of corifungin for at least 72 hours at 37 degrees Celsius. Cell viability is determined by trypan blue exclusion, where non-viable cells are determined via being dyed blue, while viable cells stay translucent or white. To the picture to the left, we can see that in area A is the control, where there's only N. fowleri trophocytes. Area C, we have evidence of plasma membrane and mitochondrial disruption, which when treated with 12.5 micrometers. And then in area D, the plasma membrane, after being treated with 18.75 micrometers, the plasma membrane became more fragmented. While in E and F, it showed that the amoeba being completely lysed at 25 micrometers. After testing that in vitro, scientists also tried it out in vivo. And by doing that, they did it within a mice model to understand how well it would respond to cells in the body. 4-week-old mice were inoculated with N. fowleri and then were treated with either saline solution and amphotericin B and corifungin at 9 milligrams per kilogram of body weight per day to compare. Observations of each treatment were done in a span of 17 days, And for 10 days of that, each compound was being administered daily. Day 17, you can notice in figure 7 that when mice were treated with amphotericin B, there was a presence of amoeba and brain tissue lysis. The study suggests only about 60% survival. But when you look at figure 8, where mice were treated with corifungin, there was a complete elimination of amoeba and brain tissue was preserved. Corifungin as a drug to treat infection of N. fowleri or PAM looks promising because it is more highly efficient than amphotericin B at the same dosage. Corifungin could then be used at lower dosages to reduce risk of adverse side effects that usually comes with treating patients with amphotericin B, such as renal toxicity, chills, and nausea. To reduce population of N. fowleri, and while it's great that there are new and improved treatments and that have been proven or been shown to have a high efficacy to reduce population, it would be the most effective treatment to reduce infection and fatality by targeting it at its population. And reducing the population is increasingly becoming more important, as what was mentioned earlier in this presentation, with the waters becoming warmer due to global warming and with N. fowleri having started to be found in water systems, such as our drinking water. From a study by some scientists, and if they found that presence of N. fowleri in waters with a higher temperature than 25 Celsius is highly likely. To combat this, they looked for the minimal level of chlorine they can use to stop N. fowleri growth. They had found that a constant free chlorine residual of around 1.1 to 1.3 milligrams per liter in bulk water and pipe walls prevents recolonization by killing off the amoeba and also disinfecting the pipes with biofilm. Cell count decreased and detectable amoeba were not found. And that's our presentation on reducing fatality on N. fowleri.